Remember, I'm just a nurse, right? All right, thank you, Senators
Just a
Miller,
nurse.
Senator Kearney, Senator Kane, Senator Capoletti, for having me here today and for being passionate advocates for healthcare and for the vulnerable populations that we serve, and for convening this hearing on something very close to my heart as a bedside nurse who's cared for this community for 37 years. I am Peggy Malone. I'm the president of the Crozer-Chester Nurses Association, a local of PASNAP, the Pennsylvania Association of Staff Nurses and Allied Professionals, which represents more than 11,000 healthcare workers across the state, and was founded on the belief that patients receive the best care when clinical care staff have a strong voice to advocate for quality of care. That's why I'm here today, and it's ironic that this is actually my alma mater. I haven't been here a long time. To advocate for access to essential care, for quality of critical care, and for my patients. I've provided care as a nurse at Crozer-Chester Medical Center for nearly 4 decades. Our hospital system has always been the cornerstone of healthcare in the community, and it's our unwavering commitment to the well-being of our community that drives the Crozer nurses, the paramedics, the pharmacists and the professionals, and the technicians every single day. We are the hospital. I know you know this. As I look around the room, I see the faces of legislators who've stood with us countless times over the last 9 years since Prospect Medical has acquired us this for-profit monster that has invaded our health system. You were there with us in 2019 when Prospect borrowed $400 million to pay a dividend to the private equity funds that controlled it, and later that year when Prospect sold the land out from under our hospitals to pay for that dividend, and a deal that required the hospitals to pay rent on buildings that had previously been owned. You were with us in January of 2022 when Crozer closed the maternity and neonatal intensive care units at the Delaware County Memorial Hospital and Springfield Hospital emergency rooms, citing staff shortages that they themselves created. You were with us 2 months later when Crozer announced plans to temporarily suspend intensive care and surgical services at Delaware County Memorial Hospital. In November of that year, Delaware County Memorial Hospital would completely close, and the community members in dire need of life-saving care. We were all of a sudden compelled to seek care outside of the county at neighboring hospital systems, creating delays in care and unsafe conditions for the entire Delco patient community. 5 months later, Crozer laid off 215 people and said it would close the sleep center at Taylor Hospital, cardiac rehabilitation, and wound care in Springfield, an outpatient drug and alcohol treatment at Crozer-Chester Medical Center. In January of 2024, the medical residency program in surgery at Crozer-Chester Medical Center lost its accreditation. Last summer, Crozer closed Taylor Hospital operating room. It's not just a business. From where I stand at the bedside, caring for your loved ones in their most desperate and vulnerable moments, it's inhumane. When paramedics don't have functioning trucks because the health system paid itself before they paid the ambulance repair bills, it's inhumane. When pharmacists don't have medicine to dispense to suffering patients because the system decided to pay itself before they decided to pay those bills, it's inhumane. When a for-profit company targets an underserved community, specifically because they are banking on the community members not having a strong voice to advocate for themselves, it's inhumane. It should also be in violation of the law. We cannot allow what happened in Delaware County to happen again in Pennsylvania. We cannot allow corporations to callously hollow out care and then leave. We cannot force nurses and paramedics, pharmacists and professionals, and technicians to carry on their back healthcare systems that are underfunded, understaffed, and overburdened. It undermines both the well-being of healthcare workers and the quality of care patients receive. The nurses at Crozer-Chester Medical Center faced a global pandemic head-on, and we stayed. Our workplace has been in turmoil for as many years as Prospect has owned it, and we are still here. We have not had a mass exodus of staff because we are not leaving our patients. We are committed to the people of Delaware County and to the healing mission that we signed up for, but it's taking a tremendous toll, and we cannot let this happen elsewhere. I am here today for my patients, for my colleagues, and for the legislators who have been with us every step of the way and who are trying to protect patients and caregivers in Pennsylvania. I strongly support Senator Kaine, Senator Kearney, and Senator Williams, Senator Capoletti, for-profit healthcare reform package and their bill protecting healthcare institutional sustainability from harmful deals, all inspired by Prospect's reign of terror in Delaware County, because we cannot let what happened to Delaware County happen in healthcare anywhere else in this country. And as you all know, we've had a lot of change of events over the last weekend, and we also have had the threat of our hospital being closed by this Friday, which would leave our patients with absolutely zero care. Our patients, and as I have said many times before, they don't have access. They don't have the ability to go anywhere else. We are close. They walk. They have family members drop them off. All the surrounding hospitals can say that they'll take our patients right now, right? They'll take the overflow. But what happens next Tuesday, next Thursday, next month? Those same families have patients, have family members who need the care. They can't get to them. They don't have the transportation. They don't have the ability to go anywhere else. This doesn't make sense, and it's criminal, and it can never happen again. One of our nurses read a letter, a beautiful letter yesterday that she had written in along with some physicians at our hospital. And I just want to read you just a little piece of it so that you really understand exactly where we're coming from. Because I speak today for an entire healthcare system of people who have stayed the course. We love our patients, and we're not leaving. Closing is not an option. For so many of us, this hospital isn't just where we work. It's where we find purpose. It's where we've built lasting relationships with our patients, celebrated recoveries, and mourned losses together. It's where our colleagues feel like family, and where our commitment to our community goes beyond professional duty. The people who work here aren't just healthcare providers. They are advocates for this community. They know their patients not by their medical charts, but by their name, by their story, by their shared moments of humanity. They are the faces patients look to in a time of crisis, the voices of comfort, and the hands that heal. Their passion for providing care to this community, it's not just a job, it's a calling. The impact on our employees is not just economic, it's deeply personal. The loss of the identity for those who have spent decades on these hills, who have made the hospital their second home. We are more often the cornerstone of this community. We are not just a healthcare institution. We are this community. We are the voices for these patients who do not have a voice of their own. And for-profit came to Chester thinking that this was a community that would not have a voice and that would not speak up. And because of all of you who have stood by us for so long, we do have a voice, and we will not stop speaking. We will not stop hollering. You will not close that hospital. Our patients mean too much to us.